Hello, I'm Jerry Vockley from the University of Pittsburgh School of Medicine and School of Public Health and the UPMC Children's Hospital of Pittsburgh. And I'm going to be presenting for you here a paper on triheptanoin for the treatment of long-chain fatty acid oxidation disorders, the final results of an open-label long-term extension study. And if you look at the manuscript, you'll see a long list of authors. These are the participating investigators from sites across the United States where this project was carried out. It was sponsored by Ultragenyx Pharmaceuticals, the manufacturer of triheptanoin. I will note, as a researcher in the program, I received support to do the study, but I received no personal income from the company at all. So if we look at the clinical pictures for long-chain fatty acid oxidation disorders, they're rare inborn errors of metabolism, and their consequences are due to the inability to convert long-chain fat into energy. There are two groups of these disorders in the long chain. They're the carnitine cycle, getting long-chain fats into mitochondria for oxidation, and then the enzymes involved in the actual metabolism inside the matrix. That's the very long-chain acyl-CoA dehydrogenase VLCAD, and then the mitochondrial trifunctional protein, which includes steps 2, 3, and 4 in that pathway. The physiologic consequences of that impaired metabolism is a reduction of ATP production. This is due to the reducing equivalents from fatty acid oxidation directly and through the TCA cycle. There's also an interruption in ketones, and because of a lack of ATP production, gluconeogenesis. And there's an accumulation of partly metabolized fatty acids that may also play into the development of cellular manifestations. The clinical manifestations fall generally into three groups: rhabdomyolysis, hypoglycemia, and cardiomyopathy. Hypoglycemia tends to be an early finding in the first few years of life. Rhabdomyolysis, which can be present early but is often mild, becomes more prominent after about age 6, and certainly is the dominant symptom in adolescents and young adults. And the cardiomyopathy with or without arrhythmia can happen at any time in the lifetime. The mechanism of action of triheptanoin is to replenish the TCA cycle. When long-chain fatty acid oxidation deficient patients are treated with MCT oil, a C8-based product, they make a lot of acetyl-CoA, but they end up with a TCA cycle imbalance because they're not keeping up with succinyl-CoA production. Succinyl-CoA comes from propionyl-CoA, a C3 carbon instead of a C2 carbon. So triheptanoin was shown in a phase 3 study that led to approval in the United States and other countries for its use to reduce the overall episodes of major clinical events and positive changes in exercise tolerance and health-related quality of life. There were also a number of other studies that were going on around this pivotal study. There were individual sponsored studies by investigators. There were compassionate use trials. There was a triheptanoin naive cohort that had not yet been into a study. And then we had a group from that first clinical study. So all of these rolled into this long-term follow-up study known as CL202. So that's what you'll find it referred to in the manuscript. For that pivotal study, we had an 18-month record gathering episode, and then we had 4 weeks run in, and then the study itself, which lasted 18 months, and then they were able to roll into this study. So if you look at the 202 study, it is defined officially as an open-label, long-term extension study evaluating the safety and efficacy of triheptanoin in patients with long-chain fatty acid oxidation disorders. I've already described the cohorts to you: the 201 rollover, the pivotal study rollover, the triheptanoin naive patients who wanted to participate in the study, and then these individual compassionate use studies. The target dose of triheptanoin was, as it was in the pivotal study, 25 to 35% of total calories from triheptanoin. And the key endpoints were much the same as the pivotal study. That is, the number and duration of major clinical events defined in these same three categories: rhabdomyolysis, cardiomyopathy, and hypoglycemia. There was also 2 health-related quality of life categories that we looked at from the short form used, and these were caregiver patient reported. And of course, we captured safety and adverse events. This slide just shows you the patient demographics, and you can see there was an even split between males and females. The total number of patients were even between the rollover and naive cohorts, and then a nearly similar number of patients coming in from investigator-initiated studies. a fairly even split across VLCAD, LCHAD, and CPT2 deficiencies, with trifunctional protein, CACT, and CPT1 being the least represented here. Of note, 85% of the 94 total patients had received MCT oil prior to starting on their triheptanoin. So if we look at the results, the key metric is here, I think, and that is that in the long-term study, triheptanoin continued to show reduced hospitalizations, and that maintained whether or not these were naive patients or had rolled over from the previous study. So it was a long-lasting effect, and you can see that on the left side. That is the rollover study. There was a long-term 85% reduction in clinical events. This is actually even better than what was seen in the 18-month pivotal trial. And if you look at the naive patients, it was at the same 85% reduction. The event duration was also reduced by, in terms of days, 76% in the rollover study, also better than in the pivotal study previously, and 90% if you were naive to triheptanoin. So it was really quite effective in keeping patients out of the hospital. In that pivotal study, there was essentially no hypoglycemia, and that was continued to be seen here. That's in the middle slide. The rate of cardiomyopathy remained at about the same, or perhaps a little bit less, 75 to 90%, and I don't have a slide for that. But what I want to point out here is that rhabdomyolysis, which in the pivotal study was really only reduced by about a third, when followed longer term, really looked much better. In the triheptanoin naive patients, there was an 86% reduction in rhabdomyolysis compared to their historic levels, while in the cohort that rolled over from the pivotal trial, it continued to stay about the same, maybe just a little bit less. And we think that was a function of the patient cohort. In that pivotal trial, we were looking for individuals who were symptomatic. And so they were already defined as the patients who were perhaps a little bit more severely affected than the general long-chain fatty acid oxidation population. That was because we wanted to capture in a small study cohort enough episodes to see a change. So the triheptanoin naive patients probably represent a better cross-section of the general population of affected patients. And you can see that now combined in the right-hand panel, the rollover total events and triheptanoin naive patients, 74% reduction compared to a 50% in the original study, but the naive patients reduction by 90%, and then the rhabdomyolysis, which was 33%, I think, in the original study, might be 37, and 48% here, as opposed to 93% for the naive study. Triheptanoin induced and maintained improvements in physical functioning in the triheptanoin naive patients. So we couldn't do this study in the patients that were already on triheptanoin, of course. So what you can see on the left is that the SF10 physical health summary patients over the course of, we were able to follow up to 4 years here, improved, although the number of patients in those later years were lower. And in the mental health summary, there was also an improvement across the study duration using the SF10 mental health summary. The long-term safety was consistent with the previous published. Most of the side effects or the adverse events were related to GI symptoms with triheptanoin use, diarrhea, some bloating, some upper abdominal pain, which we handle from a clinical standpoint. So in conclusion, triheptanoin reduced the incidence and duration of major clinical events and hospitalizations in patients with long-chain fatty acid oxidations not previously treated with triheptanoin. It maintained the reduction in the rate and duration of MCEs and hospitalizations in patients who had rolled over from the previous study, and it induced and maintained improvements in physical functioning in triheptanoin naive patients with long-chain fatty acid oxidations disorders with a favorable safety profile. And with that, I thank you for listening to this video cast and hope you'll go back and look at the full manuscript.